Hello, friends. Matt Ort here. I'd like to share a message with you today of what I believe are the 4 steps to fixing our healthcare issues in America and opening up a free market, taking that approach. I'm going to go through them. I'm going to hit kind of the high points here and not go into great detail. So I'll try to keep it brief, but as you know how that goes, I'll do my best. But number one is acknowledge the monopoly at hand. The monopoly is actually made up of 3 parties who are kind of cooperating informally. Big insurance, big hospitals, and big broker houses. They've all worked kind of within this system to design the way it is today. They're all benefiting greatly as it is today, and certainly that means we should not wait on them to fix it because it's not broken for them. Who is it broken for? Ironically, the 2 parties that are most needed for a healthcare transaction, the physicians and the patients. Doctors are very frustrated often within the hospital systems, being overloaded with patients, being overloaded with coding requirements, and not really getting to practice medicine as they dreamed of when they started medical school many moons ago, many 10 plus years ago after residency and so forth. They're not switching careers probably, right? So they're kind of on this path. And we're seeing a new path open up. But number one is acknowledge that monopoly, that it exists in every other market, whether we go to a restaurant or buy a TV or a car or groceries. We could keep going. Every other industry in America, we have the ability to shop. And if we don't like the deal, we have the ability to walk away and go shop somewhere else. The monopoly has shut that down. We don't see prices. We see, right, it's been kind of moved to here's my deductible, but then my premiums keep skyrocketing because the plan I'm on, whether it even be fully insured or self-funded through an employer, which is about half of Americans, by the way, are covered by their employer. The cost we're paying as much as 10 times the cost we should when insurance takes a cut, the broker houses take a cut, and the hospitals take a cut overall. And they're smiling, folks. So that's the monopoly we have at hand. The key is just to recognize that. Well, how do we break a monopoly? How do we open up a free market? We do it through offering alternatives to shop. The power of the buyer is the alternatives. I have many options. I'm going to choose the best value. These are skills Americans have already. These are skills employers have already. They've just been shut down in the healthcare industry by the monopoly. By the way, I think these monopoly or these healthcare executives probably played the game of Monopoly growing up and probably drove their family members into the ground. They probably ate their lunch. The problem was that's a game and this is real life. And then they go even further and lobby Washington, and then the ones that are supposed to be regulating and trust busting are not. So that's why it continues. So the only way out is going to be through a free market. So that's step one, acknowledge the monopoly. Number two, create the foundational alternative of DPC. DPC, why is DPC so important? Direct primary care. These are physicians that either never went to work for the hospital systems right out of residency, which is more rare. I know a few. Or who have left the hospital system out of frustration and started their own practices, started their own primary care practices where they can have 500 patients instead of 3,000 per physician. What DPC is really unique and a great foundation for our movement and for the alternative because it's robust. It can work inside or mostly outside of insurance is kind of the definition of direct care. But it can even work alongside a fully insured plan, which is interesting, but it can work with the uninsured as well. DPC is, we utilize DPC as the funnel in this movement. That's how hospital systems use primary care. In fact, they've reduced those physician times, interaction times down to 7 minutes. All they have time to do really is refer or prescribe, right, to have some outcome. So DPC brings that back, 30 or 60 minutes, same or next day appointments, etc., on and on. So DPC is a great foundation. So being it's so robust that it really can't be stopped by the monopoly or squashed by the monopoly, but it's also our collection. And lastly, DPC is kind of the fountain, if you will, right? The referral source. DPC can help the patient refer smartly to value, where hospital systems, for instance, tied with insurance, they only refer within. They only refer within to more expense, too expensive care, more expensive care. So that's why DPC is so critical. In the FMMA, we're in the process of listing out all national DPCs, and we're going to share this list openly on the website. And we believe this is going to be the rocket fuel and the foundation for this movement to really, really go forward. The other two, so that's step 2, encourage, support, and grow DPC fast. The next one, direct specialty care. We've seen this happen in Wisconsin and other states where we do these steps, and then DPC explodes. We've gone from 15 to about 140 in the last 4 or 5 years. And then you see direct specialty care. So direct specialty care is more vulnerable. It's not as robust. It needs the referrals for either cash walk-ins or from DPC, because hospitals are generally not going to refer to them, right? Because they see them as competition. So direct specialty care, this could be surgery centers, this could be infusion centers, this could be imaging centers, any independent general surgery, orthopedic surgery. It could be a variety of specialties, but they need the DPC foundation first. And this is how we get, right, through DPC, we get better care at an affordable cost. And then we see these specialty centers, direct specialty care, and they are affordable and even better quality as comparatively speaking to hospitals. And then last of all, so that's DPC feeds DSC. It's not the only feeder, but it's a key feeder. And then lastly, so we've talked about the seller side, creating alternatives on the seller side, right? And then lastly, we need the buyers in the game. If employers are covering half of Americans, the other half is the government through Medicare. But if employers are covering half of Americans, then we need them to revise, someone to support them in some way. They often don't know how to do this on their own, in revising their health plan to shop for value, wherever it may be. We're really not against anyone in this movement, although we must acknowledge those who are playing unfairly and those who have a stronghold and are restricting the buying of the shopper, of the patient. So when someone supports or an employer takes their own initiative, there are a few stories across the nation where an employer has revised their health plan, changed their partners to be independent partners and not tied to the monopoly. Good things happen where they simply shop for value. So those are the 4 steps, I believe, that will fix this. And how will they fix this? How does alternatives fix this? A simple example is if we have a grocery store, one monopolistic grocery store in town. If another entrepreneur opens another grocery store and that first grocery store prices were high, right? They were taking advantage of being the only option. Everyone starts going to the new grocery store. Now, here's the trick. We don't want that original grocery store to go out of business. We don't want hospitals out of business, or anyone for that matter. We just want a fair and visible and transparent free market. But that first grocery store has a choice. When everyone starts flocking to the new, more competitive grocery store, lower cost, higher quality, that grocery store has a choice. They can either compete fairly or they can be gone, right? That is the power of the free market. It happens in the restaurant industry, happens in the automotive industry, happens in every industry except healthcare. So we think that's the path for all of this to open up and for everyone to be required to compete freely in a free market and not have a stronghold on the buyer and control and say, even though our service sucks and our prices are 10 times too high and so on and so forth, you still have to shop here. We got you. That's how we release that and fix that. So that was kind of fast. That was a quick overview. I was trying not to make this a 30-minute video. So, but we certainly have broken down those steps in more detail, and glad to talk if you like. But that is what that's the path that I'm gonna lead, and that's the path that I believe can really help our country and the many Americans who are suffering now because of extremely high insurance or healthcare costs, paying a lot and getting very little. So thank you for your time today. Hopefully that was valuable for you. Have a great day.